chocolate, but but that would have completely swamped out your palate. Okay. All right, so we're all hanging in there? All right. Let's talk about a few other plant successes. And this is cat's claw. It is, it's a bark, and we use the bark of the vine, cat's claw vine. If you see cat's claw leaf, it probably doesn't work, and that's about 10 cents worth of cat's claw there. You can also buy it in already prepared tea bags and capsules in markets all over Latin America. You can buy it here in the United States as well. It's in the Rubiaceae or coffee family. Uncaria tomentosa and Guiaensis are the two species that are used. If you ever see a plant in the coffee family, pay attention to it. Not only because coffee is an important physiologically active plant, but a lot of other plants in that family have alkaloids, these bitter substances that work well. I don't know if you guys knew, but coffee is a stimulant. You guys ever tried that? So a lot of plants in this family will have very interesting effects. And this particular group in Peru, the Ashanica, refer to it as saventaro, or powerful plant. For fear of repeating those of you who are here watching me yesterday, but it has two different types of alkaloids, and one are called pentacyclic that have strong effects in the human body. The tetracyclic, I put a negative here because they either don't do anything in the human body, or if they're mixed with the pentacyclic, they completely negate them. There's kind of an antidote effect of that second group of alkaloids. Okay, so try to remember that, because the alkaloids, the pentacyclic ones, do all kinds of things in petri dishes. We see them stimulate the immune system. They're anti-cancer, strongly anti-inflammatory. In clinical trials, sorry, this is my doctor speak, rheumatoid arthritis, osteoarthritis. The pentacyclic alkaloids in an extract form in a capsule will help out people that have pain in their knees and other joints, decrease swelling, increase motion of arthritic joints. And also, if I pair up those alkaloids with a vaccine, like I give you a flu shot and then give you cat's claw, the flu shot will take better. So it's got really interesting global effects there. But the plants look exactly the same when you harvest them out in the wild. If you wanted to go and harvest cat's claw, you could go and grab that plant, and you wouldn't necessarily get the pentacyclic ones. You might get the tetracyclic ones. Unless you consulted the curanderos and asked them, they would always pick the pentacyclic plants. And I haven't figured out what they're cluing in on. So local abilities and traditional healer abilities to choose the right plants surpass our botanical taxonomy. We can't tell the difference between the chemotypes if we just use our microscopes and look at the flowers and the fruits. So I think it's a really compelling example for making sure that we work with traditional nomenclature and their abilities to identify plants. And in Eve's lab, ethnobiology class yesterday, one of the grad students was asking me, like, well, has anybody figured out or asked them, like, what it is that they're looking for? And I don't know, but that's on my to-do list. And so I'll get back to you when I find out. All right, so this is the reason I brought in this. What is this? Anybody know? It's kind of hard to tell, right? It could be a sweet potato or a yam. When you go to buy yam in the grocery store, what are you usually buying? Usually buying sweet potato because it's a lot cheaper to buy those. And I'm probably that really annoying customer at Whole Foods. It goes up to one of the workers. I'm like, is this a sweet potato or a yam? Is it Dioscorea or Ipomea? And they never know. And I know I'm not being nice. But so I'm not sure what this is. It came with my CSA, but I'll pass it around. Let's pretend it's a yam.
It's not.
But it's probably not.
It's what Americans call a yam, which is an orange sweet
Now,
potato.
yam is a tuber, right? And sweet potato is a root. Isn't that one of the ways you can tell?
Or corn. But yeah, sweet potatoes, when you call them yams or sweet potatoes, are roots, tuberous roots. But the orange sweet potatoes that USAians call yams are orange sweet potatoes.
Oh, I'm so glad you're here.
And Dioscorea doesn't look anything like this, and I'm not even sure.
You can even get it here, right?
Yeah.
Yeah.
I've gotten some in an import shop in Chicago, but I don't
Okay.
know if you can get
Everybody, Eve M. Schwiller in the botany department does a lot with agriculture, ethnobotany. So it's great you're here. Yeah, we should. So this is me holding what I thought was a yam, but I think that's also a sweet potato.
They grow farther south, wild.
Is that right?
Yeah, down in Kentucky, those are wild.
Oh, wow.
Actually, there is a kind of Dioscorea you can grow around here, but it's not usually the same kind that would be.
Okay.
But maybe in Kentucky.
I think it's the one that hormones were originally.
Okay, that's the wild Mexican one.
Oh, interesting.
It's not usually the fruit.
Now, everybody, this is not a tangent. This is really, no, this is really important because this idea of common names and Latin names, and that's one of the first things on the handout that I gave you, is when we talk about plants, we have to make sure we know what we're talking about. And there's a lot of confusion about common names. So, for instance, Dioscorea, which is the true wild yam from Mexico, or apparently southern United States maybe, has hormones in it that you won't get in the sweet potato. So diosgen and diosin are two, they look like steroids, the same background. When they're ingested by humans, it doesn't do anything like that, we don't think, because we lack the enzymes to actually convert those into progesterone, estrogen, and testosterone. So the theory that wild yam is useful for women in perimenopause when there's hormone changes, it shouldn't work because we don't have the enzymes to convert. And so usually what happens is these compounds are extracted from wild yam and they go to a laboratory. And then from that, we make the hormones in a different form that humans can process. So that's a little bit how wild yam is used in a laboratory way, but traditional thought is different. And this is one of these things when we start to talk about traditional medicine, there's lots of kind of unknowns about it. So wild yam is thought traditionally in a lot of different cultures to help alleviate estrogen withdrawal in that perimenopause time period. And it really does have some estrogenic effects when we look at animal models or in Petri dishes and other laboratory tests. So, you know what? I don't know what to make of it. And so when people ask me about it in clinic, I tell them that there's a bit of an unknown there. If they want to, they could eat it or try it and see if it makes a difference. But you can see how there's a bit of a disjunct there between tradition and science. So again, I think it's an interesting topic, and I'm going to leave you with that unknown. It's kind of like that movie, the Hollywood movie that ends and it doesn't really end, and then you think about it all day long. So anyway, maybe one of you can do your PhD on it.
Is it possible, saying that we lack enzymes, but there's still these traditional supports for the medicinal effects of these plants that we have lost, that our genes have turned off, and that we're not able to produce the enzymes anymore? Or with some sort of epigenetic treatment that we could somehow turn on genes to recreate that enzymes again, or with certain?
Yeah, and what's really, so her whole idea of enzymes being on and off, and can we change that? In my experience, a lot of herbals work on kind of a DNA protein level, so an epigenetic kind of way, which is why it often takes a long time for an herbal to kick in. If you take ibuprofen for a headache, usually you'll feel an effect within 30 minutes, but my plant anti-inflammatories take a long time because they're working on kind of a deeper level. I think that's entirely possible, and there's such a huge variation in humans and the enzymes that they have and the way that they process plants. So maybe it's possible that the cultures where wild yam is used more often have those enzymes intact, but then they get lost or changed, or I think that's absolutely a possibility.
Kind of on that subject, I've read before that some cultures in Africa that eat a lot of wild yam, they have a really high proportion of women that have twins.
Oh, wow.
So it kind of makes you, it's obviously affecting their system, and maybe they have the enzymes, and so it's having an effect.
Yeah, it could be. Did everybody hear that? Yeah. So yeah, it's interesting. Oh, do you have another question? Yeah.
I just asked one, is it possible that they're eating something else that provides the enzymes?
Oh, that idea of
Combination.
combination plants. Boy, that's interesting. I didn't know you guys were going to stump me so much today. Darn it all. I don't know the answer to that. So those are some of the kind of clinical pearls and and thinking a little bit about why this might matter to clinic. Researcher-wise, these are some interesting studies that have come up. There's a group that, of researchers that have looked at Samoan healers, and if they ask them about their favorite plants, their best plants, and then they test them in a variety of assays, it doesn't matter what the plants were used for, they always come up higher in these assays. So let's say it's a plant for headache, but it's my favorite one for headache. If they test it against HIV or cancer, it comes up higher. So traditional healers over time, and probably through trial and error, have found probably some of the most valuable player, the MVP kind of plants that then work really well in some of our research. So researchers are very keen to use plant knowledge in this way. And I would argue that more recently it's been done in a very ethical way using intellectual property right agreements, but maybe not necessarily in the past. Another example would be, sorry if you're afraid of snakes because it's kind of a scary photo, but whenever I'm traveling and I talk to healers about their plants, I always listen to what remedies they used for snakebite. And the reason is similar to that prior slide, that it's really a bummer to get bit by a snake. Has anybody been bit by a snake before? Okay, good. But it's feared, and in a lot of the pit vipers are really, really dangerous, and people can die or have really terrible local reactions. So a healer, if you're thinking about it, over time probably took their best plants and used it for that purpose. And two examples in Native American populations would be echinacea and black cohosh. And these are now plants that, for completely different medical conditions, are well proven and well used in our pharmacopoeia. So echinacea, it's not a preventive, unlike what some people think. We use it for treating colds. You should take an extract of it. Echinacea purpurea is the species. Within 24 hours of getting that tickle in the back of the throat, those body aches, low-grade fever, and it'll probably drop the duration of the cold virus for you. Black cohosh has phytoestrogenic kind of compounds in it that is very useful for hot flashes and other symptoms of menopause. So, I haven't really ever used echinacea for snakebite, but nonetheless, it's one of these that have come out of traditional knowledge. And this is Joaquin again. And in Belize, for instance, some researchers that I'm familiar with, the same idea. They'll ask them about their favorite plants and check them against HIV. So I think traditional healers have found the plants with really good chemical action, and that has translated into then follow-up laboratory studies. Let's see. So, we're starting to get these really neat stories, these compelling examples of these plants that do all kinds of important health activities. But the bummer is that of all the plants on Earth, we haven't screened that many of them. So what are there, 300,000 angiosperms or higher plants, and only about 1% have been looked at in any detail whatsoever. And the other side of it is that we can't really just sit in a lab and make things up. Nature does a much better job of that and provides us with really complex chemicals. So you've got plants out there, we haven't looked at many of them, we're losing plants, and we can't make the stuff that they have. So it's sort of, it's a really, really important issue, this idea of trying to, as quick as we can, to start working on these issues. And for me in clinic, a lot of the prescription drugs still come from plants, and or part of it comes from plants and they've been changed a little bit, so it's semi-synthetic. So for my colleagues who claim that plants aren't an important part of clinical medicine anymore, it's just not true. And it's really another reason to pay attention to this topic. This is an older IUCN Red List. Anybody familiar with that group, the International Union of Conservation? Thank you. I figured somebody would know it. Never try to wing an acronym in front of a group, because you always mess it up. This came from, I think it was 2004. But I saw a more recent Red List, and it's very similar to this. So if you think about 300,000 plants on Earth, the higher plants, a big chunk of them are on the verge of extinction. So we're going to lose 12.5% of our plants. Think of all the possible medicines, given that we haven't screened a lot of these. It's just a really, really compelling reason to to pay attention to this topic. The CITES has been fundamental in protecting a couple of plants. Golden seal now, almost extirpated from the wild in a lot of different places, but it's being cultivated, so that's a good step. And it was protected in that real crucial period with the Endangered Species Act, as was Hoodia more recently. So, getting conservation involved with this is going to protect some of these more fragile plants. And the other is that I've heard stories like this all the time from local healers about they know exactly how to harvest things so that the plant stays alive. So you can harvest cat's claw very carefully from the bark and not have to kill the whole plant. And the same thing with this plant, which we still haven't identified, Chonta chiri. You can take the strips of the bark for this when you need your shampoo from one side of the plant and not girdle the plant, and therefore it'll keep living. Another really important plant from South America, Sangre de Drago. People heard about dragon's blood. There's a way to cut the bark of the tree and collect the latex in a very safe and sustainable way that doesn't affect the tree and will continue producing over time. So that knowledge is there, but when people come in from the cities, if they've heard about cat's claw or this plant and they want to harvest, invariably they just cut the plant down because it's a lot easier. And there's story upon story of people from cities doing that when they don't have the knowledge of how to do things sustainably. All right, I think we're going to pass on this. I was going to put you on the spot and make you guys tell me what that was. That's Taxol, which is one of our big success stories. Another one would be artemisinin. People heard of this for malaria. One of our frontline drugs for malaria now, which comes from wormwood, but not the same wormwood that gives us absinthe, a different species, which was used for fevers in traditional Chinese medicine for years. And this is a great story and a really bad story. So Rosie Periwinkle gave us vincristine and vinblastine, which gives us a 100% cure rate for childhood leukemia. So, which used to be fatal. And now, if you catch it early enough, children have a 100% chance of living. But Madagascar gets 0 from it. It's probably $1 billion a year drug. So this was taken from them, and now it's cultivated and planted all over the place, but before intellectual property rights were engaged. So a success, but also sort of sad, because Madagascar has a lot of endemic species and is losing a lot of land. I'm sorry? Leukemia? Yeah, yep. This is, when I give this talk for clinicians and I'm helping them learn how to use all these different adaptogens. So this is Asian or Korean ginseng, this is Siberian ginseng, ashwagandha, American ginseng, rhodiola cordyceps, astragalus. Adaptogens are these plants that help support your body and give you energy, fight off infection, people that are convalescing from illness. It's a whole class of plants that's very common throughout the world and absolutely ignored in the United States. So if I talk to my colleagues at University Hospital about adaptogens, you can only imagine the response I would get. This idea, this vague sense of a medicine, and yet there's really compelling evidence for these working. And if you try to pair them up with these different kind of, mock patients, somebody who can't sleep, poor energy, somebody who might be depressed, or I'm just not feeling right, and you try to use your databases, you'll never be able to match these up correctly. But a traditional healer who knows about plant personalities and the nuances of plants, has a relationship with how these work on a kind of a different level, would absolutely be able to do this. So, we're very technologically savvy, but that doesn't get everything. We really need, for clinical applications, we absolutely need to have a traditional healer on our side and try to figure these things out. And you'll lose all those nuances of ginseng, for instance, especially the fact that there are 3 different types and they all behave just a little bit differently. And these are some of the ethnobotany resources that I like to use. But I would give the databases a B-, journals and books only a B+. They're not an A, which is what I would get from a traditional healer. They're missing something. Some of the books are better than others, especially when they're written by an herbalist. But you won't get everything you need from these kind of sources. And that's why I really like my Herbal Team. And we were brainstorming yesterday in class, this idea of why shouldn't there be an herbalist in a clinic? Wouldn't that make sense? You know, just, I have a psychologist, I have a nutritionist, a podiatrist, sometimes sports med and PT. Wouldn't it be great if I could walk down the hall and just knock on someone's door and say, hey, and then dump the shopping bag on their desk? Help me. Anyway, I think this is where we're going. I think we're at these kind of collaborative clinics weaving in traditional healers of different types, especially in a multicultural practice, is the only way to go. And would also help us avoid some of the adverse effects like you might get with kava. You'll be fine. You just, you just had a little bit, but we were seeing some adverse effects in high doses. Let's pass this. And the idea also that when I talk about medicines, it's not just about medicines, but it's about food. If I ask some of my patients, so are you using any medicinal plants? And the answer would be no. And then I find out that they're actually eating, 4 servings of nopalitos every day and having 5 dientes de ajo, and that might actually be enough to cause some interaction with the medicines that I'm giving them. It's a reason that we need to know about cultures and how they think that foods and medicines sometimes are the same thing. You guys did great. You listened to me talk for a really long time. I hope that I gave you a compelling reason to learn about this, the language of plants, branch out a little bit from books and databases. And I'm sure you're all better at that than I was before I started working on this. Realizing the value of traditional knowledge, how herbs and clinical practice or research or conservation are all kind of tied together, and some of these compelling benefits out there. And if you do this, I would hope that, like Gary Snyder says, you might stay together, learn the flowers, and go light. And you might look like this someday. So really, really happy. So thank you very much. Wow, you might actually make class at 1 o'clock. Anybody going to class right now? Okay.
Questions?
Oh, yeah. Oh, geez, really?
My first one is, now that the drug companies have made synthetics, do they still have the same care thoughts about the natural? I mean, I would think that, found out that it's really good for malaria. Now we don't care what happens to the natural ones.
Well, so synthetic chemistry has a role, but everyone realizes, and I just came from a meeting of synthetic chemists, that it's a very small role. So we have 1 or 2 heavy hitter drugs that have come out of synthetic chemistry, and all the rest has come out of either natural products directly or 1 or 2 steps removed. And so vincristine and vinblastine, the leukemia ones, we can't make those. They're too complicated. So they're still extracted from plants. Taxol, now they actually put it in fermentation vats with bacteria that can kick it out, kind of a genetic engineering thing. But until recently, that was still extracted from the yew. And artemisinin, the malaria drug, is still extracted. So a lot of them are just straight from plants. So yep, and people are, in good, for better or for worse, people are mining the earth everywhere. And the meeting I came from, it was all about sponges. I don't know much about sponges. I know that I use it to clean up a mess in my kitchen, but I think they grow, anybody know anything about sponges? Okay, I think there are many different species of sponges, and they make very interesting compounds that are now being looked at by chemists, as are lichens, mosses, algae. So starting to look all over the earth in very bizarre conditions, deep in the ocean or near volcano vents, and they're finding very interesting compounds. So.
Second question is, is there more of an active group of protecting indigenous plants out there who are the like devastation and deforestation and things like that? And then are there groups that are more interested based on the ethno?
The ethnobotany. Anybody have experience with those kind of groups? Because I know that they're out there, and I think it's very local. Like Larry Landsberg talked about the Achuar, and they were very organized and have done a really great job of keeping people off of their property, from oil companies to poachers. So, and I've seen really, really heartening examples of things going on. So I would say yes, that there's a lot of those movements.
I guess my thought was people maybe from the United States who are trying to assist in protecting these areas.
There was an attempt through Shaman Pharmaceuticals. Anybody ever hear of those guys? Very interesting, out of South San Francisco. And they got venture capital, and this was in the 90s. And they went all over the world, and they had a massive herbarium and a huge lab. And they were, and anytime they worked with a community, they set up ahead of time and then gave them ahead of time for benefits, and then gave them a percentage of royalties for any future drug development. And they did great for a long time and got a few drugs, phase 2 and 3, but never all the way through. And I think they found a topical anti-herpes drug, something for childhood diarrhea, I think. And I don't know what the third one was. So they almost got there. So that was one really amazing attempt. And as a result, they built a lot of infrastructure throughout the world for that kind of, the other I'm thinking of is the ICBG projects, International Cooperative Biodiversity Groups. There's several of those around the world. And those are very kind of interdisciplinary, very large grants to make sure that things are done correctly. Yeah, so there's a few things. All right, number 3.
That one was about marijuana. It seems like they were finding, purportedly finding that there's more good things about it than was previously thought. And that it alleviates a lot of different things than,
Yeah. I'm not a marijuana expert, but I do have colleagues in integrative medicine who study it and get big grants, including in San Francisco. They were using it for, I think it was for cancer nausea, I believe. And then the other was for cachexia, or weight loss in HIV patients. And it's very effective. So I think it's a powerful medicine. I think from my understanding, it's mostly a political issue why it's not